School, I worked as an electroneurodiagnostic technician at a university hospital working with seizure and epilepsy patients.
Great. Thank you for being here this evening. And then we have Garrik Jones.
Yeah, my name is Garrik Jones, and I have a private practice dental clinic on the east side of Iowa City, and I've been practicing now for a little over 2 years. I went to school here. I have my training at University of Iowa dental school, and I've been out practicing now for a couple years.
Great. Well, thanks for being here this evening.
Yeah, thank you for having us.
Yeah. And, of course, Keith, the other co-host, we better let him say hi for tonight again.
Hi.
Great. So first, just in general, do you have much contact on a daily basis with patients that have disabilities, or telling us about a specific situation that's maybe struck you as a little bit out of the ordinary?
Okay. So my experience as a student varies depending on the clinics I'm in right now. In the past, I had quite a bit of exposure with patients with head injuries or neurological disabilities. So I remember the first time I worked with a patient that had cerebral palsy as a patient in the epilepsy clinic, and just some of the challenges with moving around, helping the patient get into position for testing and things like that. So.
As a follow-up to Abbey's question, do you think you as a student are getting enough experience with disability in general?
I think that the University of Iowa tries very hard to give us a wide exposure to as many patient populations as possible. And I certainly think we could always use more exposure, but I think it's safe to say that we get a good training on a wide variety of disabilities to help the patients and what they need.
Great.
Thank you.
Thank you. And Garrik, will you tell us about your experience?
Sure, yeah. Well, in private practice, I do see some patients with disabilities, not on a daily basis, but probably maybe weekly. Disabilities or some of the older generation aged individuals that may need more time for treatment. And so, but a lot of my experience came while I was in training myself. At the dental school, they have a clinic called the Special Care Clinic, and we do a 5-week rotation there, and we see lots of patients that have lots of different disabilities. And we also do a rotation at a care center or a nursing home, which allows us to have experiences working with residents within the care center. We actually take the dental clinic to the care center and kind of set up shop in their cafeteria area, and then we see patients for a day, usually a day a week during that rotation. So, but it has opened the door to really understanding and having empathy for patients that have disabilities, and trying to understand how we can better treat them.
Great.
And yeah, so it's been good that way.
Great. Thank you. Keith, do you have any personal experience of times that you have gone into a clinic or gone to be treated and they've made special accommodations for you and were able to make you feel comfortable?
Well, after the first visit, I went with my assistant, and she put her foot down once and for all, because whenever the doctor asked a question, he asked her, and she finally turned around and said, "I'm not the patient."
That's right.
It's getting better, but still I notice if I go with anyone else, they gravitate towards that person, not me. And it can get very maddening because I'm the patient.
Exactly, and that's something I'm guessing you've received in training, and maybe it's better training now, so we can hope that these things are going to be improving. Just being more aware of people's special needs, that if someone has a personal assistant, still asking the questions directly to the patient. If they need help, then they can ask their assistant, that sort of thing. So have you seen patients that bring assistants along with them?
Yes, that happens quite often.
Okay.
You know, some of the disabled patients, some of the elderly patients will bring, you know, assistants with them. And we really strive to make an effort to talk to the patient. Excellent. Because, you know, they are the patient. We want to involve them as much as we can in healthcare. And for a lot of the patients that I see in my clinic, they're very capable and understand very well. It's only on a rare occasion where you may have to use an assistant or a translator or you know, something to help make decisions on healthcare. But for the majority of the cases, you can talk to the patient and they can understand and communicate pretty well.
Great. Have you had any experience with people with what we would call hidden disabilities, and where Keith and my disabilities are more obvious, it's out there, you can see as we approach, people with hidden disabilities such as learning disorders or mental disabilities, or even like strong allergies that you just need to be very aware of.
Or even seizures.
Sure, seizures, exactly.
Right.
Yeah, and is that does that usually come out in the screening process, or how do you go about finding out about those?
I would say my experience with finding out things of that nature is taking a careful history with the patient and asking them, besides what may be their reason for coming for the visit that day, other challenges that they feel may be associated with their health care. Occasionally, seizure patients will have difficulty with memory, either because of their seizures or their medications. And so it was important within our clinic to make sure that they had a plan that was easy for them to follow outside of their office visit because of the memory issues.
Sure.
My experience is one of the most challenging, you know, situations is someone that has various stages of dementia, because at times they feel like they're very coherent and they can understand and consent to treatment, and then there are some days where you're not sure they can totally consent to what you're doing, and that's just a challenge, and you know, they may not realize at what stage they're at themselves. And so there are some definite challenges dealing with those types of patients. But the main thing is you do need to take a careful, you know, health history, medical history, and allow time to communicate and make sure things are out in the open. It seems if we have better communication between the doctor and patient, you have a better relationship, a more trusting relationship, and you have a better chance of having, you know, success.
I really like what you just said, Derek, about taking the time to do that, and that's often what it is with people with disabilities. Like you said, they often can do it. They are capable, maybe need a little extra time, whether it's a little more time to get situated up on the exam table, or if it's someone with a speech difficulty, just giving them the time to fully answer. And unfortunately, we're often rushed in our system, but if that time can be taken, it can usually be done, and everyone is more satisfied, I think.
And unfortunately, some disabled patients are not very vocal because they let other people speak for them. But I think it's changing.
Right. I think as healthcare providers, it's really important that we really focus on the patient. Try to take time with them and really focus and make them feel like we're concerned about their care and that they're treated effectively and right.
Excellent. Do either of you have any experience through maybe while you were training or seeing a coworker, or even if you were just in a clinic as a patient yourself, have you ever seen a situation that you thought, that could have been done differently, that could have been improved upon with dealing with a patient with disabilities? I don't know, not to put you on the spot too much, but for instance, Max and I were in a training, and we went through